Hey guys, we are here today. My name is Jennifer Ragazzo, and I'm a functional medicine health coach. And I'm here with Dr. Robert Smith. He's a chiropractor,
Hello.
and we're here to chat with you guys a little bit about what Dr. Smith does outside of just the chiropractic care, and his passion for really finding different modalities to help heal the body and dig deeper into like the root cause of disease. And that has also led him to go down the path of some functional medicine testing and looking into that for his patients. So Dr. Smith, would you like to tell us a little bit more about yourself and what you do in your practice?
Sure. My name's Dr. Smith. I'm in Forks Township, and Jen and I have been working together for a little over a year, trying to help people dig deeper. And we're doing functional medicine, and I guess that's something we're going to talk about today is what that is. And that term's kind of floating around on the internet a lot, and people use it, but what does it really mean? It may mean something a little bit different to every practitioner, but to Jen and I think it really means not just treating symptoms, but try and find the root cause of problems that patients are having. So it's not just take this pill to treat this symptom. It's what's the underlying pattern, what's causing this problem, and how do we change the whole person, right? Not just taking a pill, but diet changes, lifestyle, sleep, exercise, spiritual, the way you think. All of those things really are part of it. So that's part of functional medicine, and part of it is, we talk about dis-ease or disease, and the body always tries to find homeostasis. So we talk about that in chiropractic a lot when we treat patients. We're really not, I'm not healing a patient. Their body's doing the healing. I'm just pushing their body toward homeostasis.
Yeah, I love that. I love how you're talking about, pushing the body towards homeostasis, and that's really where the body wants to be. So in digging deeper and trying to uncover, what are some of the root causes of somebody's, like you said, dis-ease in the body, whether it be inflammation, gastrointestinal issues, insulin level issues, or hormone issues. So what are some of the, well, first of all, what led you to dive deeper yourself into this world?
That actually starts about, I hate to say, about 25 years ago. When I graduated from college, I was going to go to medical school. That was the plan. I was accepted to medical school. I decided to wait a year after college because I needed a break. So during that year, I really decided I wanted to go to chiropractic school instead. And so that's the route I took. And I just felt like I wanted to be more natural in the way I treated people. So that was really the first decision I made down this path of trying to treat people with functional medicine. Was I wanted to be natural in the first place. The second thing, big thing that happened, probably the biggest thing, was when I was in chiropractic school, I decided to take a weekend seminar with Dr. Frank Strahl, and he was a chiropractor. He was doing functional medicine in the 80s. He was a chiropractor, but he had an obstetrics and gynecology practice.
Okay.
Believe it or not.
Awesome.
That's what he did. So in his seminar, he introduced me to the concept of using blood work to treat people nutritionally and naturally. And I still have all of his handouts. Basically, it was going through patients' blood work manually, trying to look for the patterns, and he had a system for doing that. And I've used that over the years, and I kind of refined it as I learned more. But that was that was really the beginning. And that was in the late 90s when I took those weekend seminars with him. So that totally opened my mind to, I can do more than just be a chiropractor and treat the skeletal system. I can treat really from the inside out. So that was the second really big decision I made. The third decision was when we had children, and those of you who have kids, you know how they kind of change your life in many ways, but they changed our thinking. My oldest son had a problem, and I eventually figured out he had a gluten sensitivity, and this was about 15 years ago. And 15 years ago, you could not go to Giant and find gluten-free products. So we had to start going to the health food store for him separately. And at that time, my wife and I thought we thought we were pretty healthy eaters, but we didn't know anything. We did not know anything back then, really, compared to what we know now. So just that situation with my son really led us to a paradigm shift in the way we ate and learning about raw foods, raw cooking, whole foods, and some big changes. So that was kind of the third milestone, really. And then the fourth thing was, I've been in practice for 18 years, and I noticed over the years, patients would tell me about other health problems they had while I was treating them. And they would be complaining they're not getting better. They've been to this doctor, they've been to that doctor. No one can help them. All the doctors say they're fine, their blood work's normal, nothing's wrong. They prescribe maybe an antidepressant or some other medication for the symptoms. And patients are telling me over and over again, I want to do something about this. What's wrong? So after a few years of this, I started realizing, you know what, I can actually help you. And I started asking patients, bring in your blood work, let me look at it. And they would ask me questions. Sometimes I wouldn't know the answer. And this was back when the internet was in its infancy. So it was hard to find things out. It was really hard to find things out, but I would always say, I don't know the answer to your question, but I'm going to find out. And so that just led to more and more of that. And eventually people would just start bringing all the records in to their appointments, a stack. I mean, I had, this is a new patient the other day. She came in for me to treat a back problem. And she says, by the way, I'm having all these other problems. And I get this stack of records.
Right.
Can you look through these for me? Right. So,
but there's a need because people need that.
Right. Yeah, and they're not getting it anywhere else. So,
exactly.
Right.
Yeah. And I can say, because you've been my chiropractor for over a decade now, and it's been an interesting relationship, because starting as your patient, over a decade ago, I was in a very different place as well with my own health, like you, thinking that I was very healthy, but my knowledge of health and wellness has evolved so much over the years. And you were the first person who ever took a deeper look at some of my labs, who ordered the full thyroid panel. You discovered some things that were off in my own body that repeatedly I kept bringing back to my doctor and saying, I'm not feeling right. I feel off. And everything was normal, never getting any guidance. But you were the only person, practitioner in my life, that was offering me any type of guidance whatsoever outside of just prescription. You want a prescription or not? And allopathic medicine absolutely has its place, but that's the beauty really of going to alternative practitioners that take the time to pause and look at the whole picture. Like I like to say to my clients a lot, I use the analogy of like puzzle piecing, and every one of us is a puzzle. We might be 100-piece puzzle or a 5,000-piece puzzle, but we got to dump the pieces out and spread them out and see what we have. And then we can start to put those pieces together. And I knew from the time that I met you and started seeing you as a chiropractor that you were so much more than somebody who was just going to address my, alignment issues. You always asked questions about sleep, water intake, exercise. I mean, all of those, the very holistic thinking. So what have you seen in your own clients? What are some benefits that you've seen in really being able to dig deeper, offer them some functional, like your lab work is much more extensive. They can go to their Quest or their LabCorp with a script from you for that. But, you and I both look at things, a lot more extensively, and the interconnectedness, but also you've been ordering functional medicine testing, like comprehensive stool analysis, hormone testing, food allergy testing. You've been doing those things and offering those things to your clients for years, your patients. What are some benefits to that?
Right. Well, you can only find out so much with lab work, really. And I found, especially with hormones, that seems to be the big one. Your blood levels of hormones aren't really helpful. They can form sort of a baseline or a guideline, but you really need to look at hormone levels in either saliva or as a byproduct of urine metabolism, and you get much more accurate readings that way. So that was frustrating to me for a number of years when I would order blood work for women having hormone problems, and it would come back and everything looks fine to me, and I know from the patient's history and symptoms, something's not right here, but the blood work's not showing it. And that's when I started looking for, saliva tests, and then last year the Dutch test,
right,
which gives so much information that I don't feel like I've mastered that at all.
Yeah.
But it's so much more information than we used to get from blood work.
Right.
And also the other thing would be the food sensitivity testing, because again, a lot of patients would have the traditional allergy tests for foods that would come back fine, but patients would always say, I know I'm reacting to this food. I get a headache, or I get a rash, or I get a racing heart after I eat this. But the allergist said all my allergy tests were normal.
Right.
So that's when I started looking for something else, and that's when I started using the ALCAT, because that shows in much greater detail, not an allergic response, but an inflammatory response. So those have been helpful to uncover things that patients know something's wrong. They know their body. They know something's not right. And it's helped me to be able to identify it instead of the frustration of saying, well, your lab work's normal.
Right, absolutely. And you're seeing, people are coming to you, and they're coming to you on a regular basis as their chiropractor, and they're coming to you with inflammation, whether that be headaches or back pain or knee pain. And as well as I do, that very often the root cause of inflammation is a food sensitivity, or there's something going on in the gut, or the cortisol levels are off. And in order to really be able to holistically treat that person and help optimize their health and help them to really feel true relief, you have to address deeper things. You have to address those things. I was really thinking about one of my clients that I sent over to you, and he went a recent guy, and I sent him over to you, and you ran a lot of blood work on him, more extensive than he had brought to me from his PCP. And the two of us collaborated and found some deeper things going on with him. He's changed his diet. He's changed his lifestyle. His energy is increasing. And one of the things that he had said to me from day one was his back pain was so bad that he was unable to exercise. He was only walking. You sent him for x-rays, and you did your own chiropractic assessment on him. And when I saw him yesterday, he's like, my back pain is almost all gone. And we chatted about part of that is the work you're doing with Dr. Smith chiropractically, but a huge part that I'm very confident is it's the changes that he has made in his diet. He's brought down his insulin levels. He's brought down his cholesterol. He's eating a very anti-inflammatory diet and prioritizing like stress relief and all of that. This chronic back pain that he thought was keeping him from doing much more than ever even walking, the guy has lost 25 pounds, so all like really, really looking at all of those different things can truly bring people full relief, which is, I love that you're doing that. And in your practice, you've been able to expand. I mean, you and I have been able to partner together so that you can send people over and I can help coach them through these things and these lifestyle changes. And then you've also brought on an acupuncturist, and you have massage therapy, which you've had for a while, and you've got somebody who does cranial sacral and Reiki. So all of those different modalities are really bringing your patients fantastic results.
Oh, and the patient you're talking about, I know it's mostly what he's done because I've only treated him 2 times, right? So, obviously I put together some rehab exercises, things for him to do at home every day. And I've stretched him and I've adjusted him, but really it's all the other homework he's done. And he really totally bought in.
He did buy it.
He was totally committed to doing it. So yes, maybe the adjustments and the exercises have helped, but it is the inflammation that he had, it's the weight loss, and it's the diet change. And he even said to me, he said, I don't want to change anything I'm doing right now because it's the best he's felt in over 20 years.
Yeah.
So he wants to continue doing what he's doing. And that's what I found makes patients more successful when they're like him and they just totally buy in. They've kind of hit a wall and they're ready to make the total change.
Yes, that's absolutely true. And I can completely concur with you on that, because people have to want to make these changes. Just moving one piece of the puzzle is not going to necessarily bring them that relief that they are looking for and be able to truly optimize their health. And that's why just diving in deep, being committed to change your lifestyle, whether that be going home and doing different stretches or, swapping out a food that wasn't working for you, all of those things, that's really what functional medicine is all about. It's about looking for the interconnectedness in the body and helping to optimize a person's health. And that's maximizing certain things, minimizing others, and prioritizing like that body's ability to heal. So that's amazing. That's awesome that you've been able to really expand your practice and change so many people's lives. That's awesome. Is there anything else that you want to leave us with?
I think just what I would leave with is if patients want to do this, if they want to dig deeper, it's an investment, really. The quote about take care of your body, it's the only place you have to live, is really true. And if you want to live a long life, not just a long life, but a quality life well into your golden years, you have to make the investment. And it's not just an investment of money, it's your time, it's your energy, your resources, but you will be successful. You can't exercise one time a week and hope to make a gain or make improvement. You're just going to kind of tread water. So if you really want to get to the bottom of it, and you're seeing Jen as a health coach, or you're seeing me or someone else that's holistic, you have to buy in, really, if you want to be successful. It's mostly what you're going to put into it.
Yeah, absolutely. Absolutely. It's, staying ahead of disease is what is really ideally what we want to be able to do instead of triaging. When you're sick, when you're in pain, when you're not feeling well, that's not the time to all of a sudden start triaging. What we want to do is, like you said, invest in our health now. And the short-term investment that you're making, even if it means spending some money on different modalities of care or functional medicine testing, that's a very, very short time in your life. And that is a priceless investment to make in the long term. I mean, if you want to drive your car, for instance, until it dies, until it can't get another mile on it, you have to invest some money in that car and some effort. So it's worth it. I mean, I can say in my own health journey that all of the things that I have invested in myself, starting with chiropractic care when I was very young when I started chiropractic care, so to speak, for someone in my generation. And that has opened me up to so many other different things that have been very powerful. So thank you so much. I'm really glad that we were able to have this conversation and have you share a little bit with our audience about what you do. And if anybody is in the Lehigh Valley area, I can highly, highly recommend Dr. Smith as a chiropractor, because as you've heard in this interview here, he is so much more than just a chiropractor who adjusts you. He really does. You really do walk your talk with the name of chiropractic whole health. I mean, you really offer people a whole health approach. So that's fantastic. Well, thank you so much.
Right.
Really, really
Thank
appreciate
you, Jen.
it. Take care.
All right.